So first of all, chronic pain that occurs in this approximate area. What could this be? It could be a general spasm of our quadratus lumborum muscles. Our quadratus lumborum muscles attach to the lower rib as well as to the crest of our pelvis. Accordingly, when they are contracted on one side or the other, we feel tension in them. As a result, we feel pain in them. The cause of this could potentially be an anterior pelvic tilt and pronounced hyperlordosis in the lower back. Today, we will first discuss what to do about this, how to stretch and how to restore these muscles to their normal tone. Next, the piriformis muscle, the so-called Piriformis Syndrome. We encounter this quite often in our practice. What appears? What kind of pain? The pain can be roughly in this area of the buttock. The pain can radiate down the leg. It can cause a burning pain. It may be a chronic constant pain. Sometimes certain positions make it feel better while others make it worse. It depends on the condition of the piriformis muscle itself. Why does this happen? Let me explain. The gluteus maximus muscle. Here it is shown. Its function is to move the leg backward. Accordingly, when our gluteus maximus muscle does not properly perform its important function of moving the leg backward for a long period of time, other synergist muscles may begin to appear in order to help it. And in this particular case, the piriformis muscle also gets involved. But moving the leg backward is not really the job of the piriformis muscle. When it takes on this function, it contracts and starts to compress the sciatic nerve. As a result, we experience localized pain, which can also radiate down the leg. What should we do about this? I'll also show you what to do in the exercises today. And thirdly, the area between the shoulder blades. The pain can be somewhere here at any of these points. It can radiate between the ribs, go upward, or it might just be a constant localized pain between the shoulder blades. What does this mean? This indicates constant static overstrain in the area between the shoulder blades. We have the muscles of inhalation, which are the muscles that lift our shoulders up, and we also have the muscles of exhalation, which lower our shoulders during the act of inhaling and exhaling. Accordingly, when our inhalation muscles are too strong and overstrained, the exhalation muscles will always be too weak because they are antagonists to each other. And with static overstrain, trigger points will start to appear in them. What does this mean? It means that the back is trying to return our shoulder blades to their physiologically correct position, like this, but at the same time, these muscles don't have enough strength and they are constantly in a state of static overstrain, developing so-called trigger points. And today we will also discuss what to do about this, how to return our shoulder blades to good posture, and how to relieve the constant overstrain that can radiate to the neck, between the ribs, and sometimes even downward. So stay tuned to the channel, let's start doing the exercises. First, we need to find a doorway. Why? So that you can grab onto the doorway with your hands and hold on firmly just like this, as you can see Vlad is doing now. Second, we need to gently and slowly pull back while rounding our pelvis as much as possible. The knees can be slightly bent. And third, we do these gentle side-to-side stretches, which are important for the quadratus lumborum muscles in your lower back. Let me remind you, the muscle attaches from the lower rib to the iliac crest. So when we do these twists to the left and right, our muscle gets stretched. We perform this exercise for 15 repetitions on each side, taking our time and carefully avoiding any sudden, overly sharp movements. If you experience any sharp pain while doing this, it's best to stop the exercise immediately. With your arms relaxed, gently move side to side, focusing on smooth and steady motions. You can use your breath to help. Exhale slowly and fully with each movement to help the muscle relax even more. When we turn to the left leg bends accordingly. When turning to the right leg bends accordingly. 15 repetitions on each side. Now the second exercise. Pain in the area of the piriformis muscle, right here. Sit on a chair and place the foot of the leg that bothers you onto the other leg. And so what do we do next? We simply lean the torso forward, thus stretching the piriformis muscle, then return to the starting position. If there is sharp pain, do not push into it, go only to the point where you feel the onset of pain, then return to the starting position. Do 15 to 20 repetitions like this. Be sure to gently exhale as you slowly lean forward. Why is this necessary? First, it helps us to avoid straining and also prevents our blood pressure from rising. Second, by exhaling, we help our muscles stretch more and move into the correct physiological position, thereby reducing compression on the sciatic nerve and accordingly reducing overall pain. You can also do 15 to 20 repetitions on the side that doesn't bother you at all. And the third problem is pain between the shoulder blades, which can radiate anywhere, upwards, downwards, into the ribs, and sometimes even further. Our task is to engage the exhalation muscles, which need to be strengthened, and pull our shoulder blades downward. How do we do this? Place your hands in front of you, like this, and as you exhale, bring your shoulder blades together and pull your elbows downward. Make sure that the upper part of your trapezius muscle does not tense up. Only the area between the shoulder blades and the lower trapezius, the lower part of the trapezius muscle, should be engaged. Do 15 to 20 repetitions like this. If you experience sharp pain, avoid it and work within a range of motion that does not cause sharp pain. If the pain still occurs, it's better to stop and consult your doctor or a physical therapist. At the same time, keep your neck in a neutral position. It should not move forward or backward. Our goal is to strengthen only the area between the shoulder blades and just below them. I assure you that even after doing the exercise, you will feel relief because you will be working with the trigger points in this area. As a result, blood flow will improve there, tension will decrease, and the pain will gradually subside. And at the very least, with the help of this exercise, you will improve your posture, you won't have rounded shoulders, and your shoulders won't be hunched forward. And accordingly, at the very least, you will look better aesthetically. So friends, the first exercise. With this exercise, we will warm up all sections of our spine. That includes the cervical, thoracic, and lumbar regions. It's a simple exercise. Lie comfortably on your stomach with your arms bent at the elbows and placed in front of you just like this on the sides of your body. Then simply perform the following gentle movement. Gently lift yourself up so that your lower back muscles are engaged just a little bit. We don't do a strong extension, just about halfway of what you can do. Lift up, raise your chest. Your head also comes up, but not thrown back. Just lift it so it doesn't stay on the floor. At the same time, raise your arms and pull your elbows down. Exhale, return to the starting position. Starting position. 3. I feel it in my cervical, thoracic, and lumbar spine. My lower back is also tensing up a little. 4. What does this exercise do for us? This exercise pumps like a pump. The muscles, like pumps, will steadily circulate blood along the entire length of our spine. In this way, the muscles will be ready for further elastic work. We do not push into acute pain. If there is pain somewhere, do not use a very large or excessive range of motion. That is, relatively speaking, if I feel that pain appears here, I only rise halfway. I try to gradually increase the amplitude just a little bit each time. 9. 10. I'm still stretching with my elbow. 11. 12. 13. 14. 15. If you're feeling a little bored, you can stop here and drink some water. 16. 17. 18, 19, and finally 20. Enough? Dear friends, today we performed just one approach to the exercise I showed you earlier. It is necessary to warm up your back. Take a sip of water, and the next exercise, we're going to do the cat pose. I think many of you already know it, but it's important. Let me remind you again, it's important to do the exercises in the order I show them, because we have anatomical muscle chains. and we are working through them, directly pumping blood along the entire length of these chains. This is what they look like for those who don't know what they are. It's the connection of all the muscles, so to speak, between the neck and our heel. What is the connection between them? Accordingly, that's how we work. So exercise number 2 is the cat pose. Don't skip it. We get into this position, and then what do? Arch your back upward as much as possible. Let your head drop down. I've rounded my back and stretched out my lower back. I've stretched out my cervical and thoracic spine. And then I do exactly the opposite. I arch my lower back, arch my thoracic spine, and I tense my cervical spine. Exhale slowly and fully. Now stretch your body again, gently and mindfully. Try to feel all the different sections of your body as much as possible. Arch your back once more as you exhale deeply and completely. And number 3, don't rush, just take your time. If you feel any pain or discomfort in any section, you can really focus your attention there. And try to gently stretch as much as possible in that particular spot without forcing it. Now, slowly move into the starting position. Starting position right at the very beginning of the sequence. All right, let us begin. Starting now. Starting right now at this moment. That's enough. All right, let's move on to the third exercise. The third exercise is what's called pumping, so-called pumping. It also includes elements of stretching and elements of pumping blood. Pumping blood through our muscles and delivering it to our spine. Let's go. So get yourself into this position. Now gently pull back just a little bit and then slowly move forward. Arch your back. Very slightly and as much as you comfortably can, gently round your back inward. Once again, slowly move back and stretch your body. And then return slowly to the starting position that I showed you. Exhale. And twice back, feel how your lower back stretches. You can even play a little moving left and right like this. And come up again, making sure to move slowly and with control. If you can't arch your back, or if you feel pain like this in your lower back, do not go all the way down. Only lower yourself as far as feels comfortable and safe for your body. And 5 and 6. To be clear, that makes a total of 6, just to emphasize. And 7. Let me repeat that just to be clear. 7. And 8, which is the number 8. Let's move on. And in total, altogether, as a result, that makes 9. Last one, that's 10, all done. Now please lie down on your stomach, making sure you are comfortable. Take a moment to relax and settle in. Place your arms out to the sides like this. And what do we do next? The right leg stretches to the left side without lifting your arms. Return to starting position. Left leg stretches to the right side, pointing your toes toward the floor. And at the end point, pause for a brief moment and really feel how your back gently springs. Take a deep breath. Again. 2. And on the exhale, 3. Now you can gently rest your head down, relaxing completely. 3. Let us count. And then 4. Exhale slowly. 4 and 5. Take a gentle deep breath. 5 and 6 and 6. As you reach 6, remember to exhale slowly and completely, letting all the air out of your lungs. Feel your body relax with each breath out. And 7. You can make it just a little bit more challenging in order to stretch the thoracic area as well as the chest muscle at the same time. Place your hand at a slight angle and on the very edge. And when we turn, press down with your whole body weight to stretch the chest muscle right here. This will help stabilize our neck. 7. And 8. and 8 in total. Let me count. 1, 2, 3, 4, 5, 6, 7, 8, and 9. 9, sure. 10. 10. Finished. Friends, we also perform this exercise 3 sets of 10 times on each side. I really hope that this complex wasn't too difficult for you. If it seemed hard and challenging to you, friends, you can do fewer sets or you can use a slightly smaller range of motion. But remember, each time you should increase the number of sets, repetitions, and the range of motion. Why? Because the greater the range of motion, the more the muscle stretches and the faster it returns to its physiologically correct position.